Have you ever felt a strange itch on your skin that won't go away, no matter how many creams or lotions you use? It's easy to think it's just a minor discomfort or something related to age, but the truth is, the itch could be a much more serious warning sign. Many people ignore this symptom, thinking it's just temporary. But what if I told you that persistent itching could be a sign of something serious, like cancer? Before you dismiss it as an exaggeration, I invite you to listen closely to what I'm about to share with you today. Itching isn't always just irritation. It can be linked to much deeper issues, especially when it appears in specific areas of your body. I've heard surprising stories from patients who realized too late they were ignoring critical signals. It's vital to pay attention to the smallest details of our bodies, as they could be the key to preventing serious illnesses. If you've ever been searching for the cause of an itch that won't go away, or if you've tried everything without success, it's time to understand the possible causes behind this symptom. What might seem like a simple discomfort could actually be a warning sign that something is wrong inside your body. Cancer and other serious diseases have early symptoms that many people overlook, but a simple itch could be the clue that saves your life. It's common to think that an itch on your skin is just a superficial problem, but your body has ways of warning us about internal problems. We often ignore these symptoms, but itching can be linked to serious illnesses. What seems like a minor discomfort could be an important signal that we can't ignore. In this video, I will tell you about real cases of people who noticed unusual itching and how that simple symptom was the key to detecting serious illnesses like cancer. By the end, I'll also show you how to self-diagnose and recognize when your body is sending you a warning sign. Throughout this video, you will discover the 6 areas of the body where itching can be a sign of cancer, how itching in certain places can be more serious than you think, simple steps to self-diagnose at home, and when to seek professional help. Stay tuned until the end to learn how a simple itch can change your life. This video could be crucial for your health or for someone you know. If you find it helpful, don't forget to like, subscribe, and share it so more people can benefit from this information. 2. Itching as a warning symptom. Itching is something common. We've all experienced that sensation on our skin that makes us scratch and try to relieve the discomfort. However, it's important to know that not all itching is the same. Sometimes persistent itching can be a sign that something more serious is happening inside our body. In most cases, itching is just a temporary response to an external factor, like an insect bite or irritation caused by cold or heat. But when the itching persists, especially without a clear cause, it can be a sign that something is wrong internally. This is when we need to stay alert. For example, itching related to skin conditions, such as eczema or dermatitis, is usually localized and responds to topical treatments like moisturizers or corticosteroids. However, if the itching doesn't improve with these treatments or worsens over time, it's time to consider that there might be something else behind this symptom. One of the main problems we find is that many people tend to ignore persistent itching, thinking it's just a temporary discomfort. Often, itching is the first sign that something in the body isn't functioning properly. In some cases, like with lymphoma or pancreatic cancer, itching is an early sign that could save lives if detected early. How do you know if the itching is a sign of something serious? The key is to pay attention to several important factors: the duration, intensity, and location of the itching. If the itching persists for more than 3 weeks without improvement, or if it occurs in a specific area of the body, it could be a sign that there is an internal problem that needs medical attention. A key factor is the type of itching. If the itching is more than just a simple superficial irritation, and if it doesn't respond to common treatments, you should suspect there might be something more going on. For example, in the case of itching associated with pancreatic cancer, this doesn't get relieved by creams or lotions. This type of itching typically worsens at night and doesn't improve over time, which is a signal that something else is happening internally. Another important aspect to consider is the context in which the itching occurs. If the itching happens irregularly, like at a specific time of the day, or if it's accompanied by other symptoms such as unexplained weight loss, fever, or extreme fatigue, this is enough reason to seek medical attention. Why can itching be related to cancer? Cancer is one of the most feared diseases due to its silent nature. In its early stages, it can be difficult to detect. as symptoms aren't always obvious. However, some types of cancer, like lymphoma, can manifest through persistent itching. When the lymphatic system is affected by cancer, it can cause itching in different parts of the body, especially when the cancer is in its early stages. The itching associated with cancer is generally not something that can be solved with superficial treatments. If you experience continuous itching, especially if it's accompanied by other symptoms like loss of appetite, unexplained fatigue, or lumps in the body, it's crucial that you don't ignore it. It's important to note that early detection of any type of cancer significantly increases the chances of successful treatment. 3. The 6 areas of the body where itching can be a sign of cancer. Itching, although in many cases a benign symptom, can be a warning sign for more serious problems, including certain types of cancer. Below, we will talk about the 6 areas of the body where itching can indicate the presence of a serious illness, specifically cancer. Paying attention to these signs can be key for early detection. Lower legs, lymphoma. Itching in the lower legs, especially the front part, can be an early sign of lymphoma, a type of cancer that affects the lymphatic system. Lymphoma can cause itching due to the inflammation of lymph nodes. When these nodes become inflamed, inflammatory substances can stimulate the peripheral nerves, which causes that itchy sensation. The itching associated with lymphoma usually doesn't improve with creams or lotions. In fact, in many cases, it worsens. If you notice that the itching persists for more than 3 weeks without any improvement, it's time to get checked by a doctor. It's important to mention that lymphoma in its early stages may not show other obvious symptoms, so itching could be one of the first signs to consider. 2. Middle of the back, pancreatic cancer. Itching in the middle of the back, particularly around the upper part, could be linked to pancreatic cancer. This type of cancer affects the pancreas, a crucial organ in the digestive system. The pancreas is connected to nerves in the upper part of the back, which means problems with this organ can manifest through itching in that area. What's most important is that this type of itching typically worsens after meals. If you notice that after eating, the itching in your back intensifies, especially if you also experience symptoms like poor digestion or weight loss, it's essential to consult with a doctor. Pancreatic cancer is known for being difficult to detect in its early stages, so being aware of these symptoms can make a big difference. 3. Scalp, leukemia. Itching on the scalp can be related to leukemia, especially when it's persistent and doesn't respond to typical treatments. Leukemia is a type of blood cancer that can cause itching in areas like the scalp, the back of the ears, and the neck due to the overproduction of white blood cells. This itching generally worsens at night and may be accompanied by other symptoms such as unexplained fatigue, easy bruising, or bleeding. If you've noticed constant itching on your scalp and have tried switching hair products without relief, it's important to seek medical attention, as this could be a sign of leukemia or another serious blood-related condition. 4. Chest, inflammatory breast cancer. Itching on the chest, particularly around the nipples or under the breasts, could be a sign of inflammatory breast cancer, a rare but aggressive form of breast cancer. This type of cancer causes changes in the skin of the breast, which may include itching, redness, and a texture similar to orange peel skin. It's important to note that inflammatory breast cancer doesn't always present lumps like other types of breast cancer. If you experience persistent itching in one area of your breast that doesn't improve with changes in clothing or hygiene, and if you notice that the skin in that area becomes thicker or looks unusual, it's crucial to get a medical checkup. 5. Genital areas, vulvar or anal cancer. Itching in the genital areas, such as the vulva or around the anus, could be a sign of vulvar cancer or anal cancer. These types of cancer can cause itching due to irritation caused by tumors pressing on nearby nerves. In addition to itching, other signs may include changes in skin color or texture, bleeding, or persistent pain. If the itching in these areas persists and doesn't respond to common treatments like creams for irritation and is accompanied by other symptoms like bleeding or pain, it's important to consult with a specialist. Although vulvar and anal cancer are rare, early detection can be key to successful treatment. 6. Hands and feet, internal cancers and systemic diseases. Itching on the palms of the hands and soles of the feet could be related to internal cancers. Cancers in internal organs, such as the liver, lungs, or pancreas, can release toxins into the bloodstream that affect the peripheral nerves, causing itching in the extremities. This type of itching doesn't get relieved with creams or lotions and typically worsens at night. If you experience itching only on the palms of your hands or the soles of your feet, especially if it's accompanied by other symptoms like weight loss, fatigue, or changes in the skin, it's important to seek medical attention. These symptoms could be related to more serious problems such as systemic diseases or internal cancers. 4. How to differentiate between normal itching and dangerous itching. We've all experienced it, an itch on the skin that leads us to scratch and try to relieve the discomfort. In many cases, this is simply a temporary itch due to external factors like dry skin, sweat, or even a change in season. But sometimes, itching can be a symptom of something more serious, and it's essential to know how to distinguish between the two. Duration of the itch. The first thing you should observe is the duration of the itch. How long has it been since you started feeling it? Does it happen every day or only at specific times? Itching that lasts for several weeks without improving with common treatments should be cause for concern. Recurrent or chronic itching can indicate an internal problem that needs medical attention. 2. Response to common treatments. Itching caused by common irritations or allergies usually subsides with basic treatments like moisturizers, oils, or anti-itch lotions. If, after applying these treatments, the itching continues to worsen or doesn't show signs of improvement, it's a clear sign that something else might be going on. Itching related to certain internal conditions, like cancer, will not respond to creams or antihistamines. If this is the case, it's essential to consult a doctor as soon as possible. Location of the itch. The location of the itch also plays an important role. While a common itch usually occurs in a general area from a small zone or due to an external cause, itching related to serious health conditions generally presents in a specific part of the body. As we've mentioned earlier, areas like the lower legs, scalp, back, chest, or genital regions can be indicative of something serious. If the itch occurs in one of these specific areas and doesn't improve with common creams, it may be a sign that something more serious is happening. 4. Nighttime itching. An important thing to note is that itching related to certain internal problems like lymphoma or pancreatic cancer often worsens at night. This is because the lymphatic system becomes more active while we rest, which intensifies the symptoms. If the itching becomes more noticeable when you lie down to sleep, especially if it wakes you up in the middle of the night, this could be a red flag. Nighttime itching is often a characteristic of more severe conditions and should not be overlooked. 5. Other accompanying symptoms. Another factor that can help you determine whether the itching is benign or dangerous is the presence of accompanying symptoms. If the itching is accompanied by fever, unexplained weight loss, extreme fatigue, or visible spots or lumps on the skin, it's time to consult a doctor. These symptoms combined with the itch can indicate serious diseases such as cancer that require immediate attention. 6. Itch without explanation. Sometimes the itch occurs with no clear external cause. It can be especially concerning if there is no source like a bite or irritation and no change in your routine that justifies it. Unexplained itching could be a signal that the body is reacting to something happening inside. In these cases, it's important to see if the itching persists and if it improves with standard treatments. 5 steps for self-diagnosis. Self-diagnosis doesn't replace medical consultation, but it's a helpful tool for identifying early warning signs. Here, I'll provide you with some practical steps you can take to observe and evaluate the itching you're experiencing, which will allow you to make informed decisions and seek professional help if needed. Track the duration of the itch. The first thing you should do is track the duration of the itching. How long has it been since you started feeling it? Does it happen every day or only at certain times? If the itching persists for several weeks without improving with common treatments, it should prompt a medical consultation. If the itching is recurrent and doesn't go away, make a note of how often it occurs. 2. Evaluate the type of itch. Next, analyze how the itching feels. Is it a surface-level itch, or does it feel like it originates deeper in the skin? Surface-level itching, like from dryness or insect bites, typically improves with creams or lotions. If the itch feels deeper, more persistent, and doesn't improve with topical treatments, it's important not to disregard it. A deeper or more intense itch may be linked to more serious conditions. 3. Look for other symptoms. Itching doesn't usually appear alone. Pay attention to any other symptoms you may be experiencing, such as fever, unexplained weight loss, extreme fatigue, or changes in the skin. If the itching is accompanied by any of these symptoms, it's essential to seek medical attention as soon as possible. These symptoms can be signs that the itch is related to a more serious issue, like cancer or a systemic disease. 4. Identify the area of the itch. It's important to identify the specific area where you feel the itch. Is it a widespread area on your skin, or is it localized to a specific spot like your legs, scalp, or chest? If the itching is localized to certain areas, such as the ones mentioned above, and doesn't improve with common creams, it could be an indication that something more serious is going on. 5. Keep track of the evolution. Keep a daily or weekly log of the itching, noting the time it occurs, its intensity, and any changes you notice. This can be very helpful when consulting with a doctor, as it will allow them to make a more accurate diagnosis based on the information you provide. If the itching worsens over time or changes in pattern, it's a sign to seek medical attention. 6. Consult a health professional. If after following these steps, the itching persists, intensifies, or is accompanied by other severe symptoms, don't hesitate to consult with a specialist. A doctor will be able to perform the necessary tests to determine the cause of the itching and recommend the appropriate treatment. Remember that early diagnosis is key to successful treatment. 6. The importance of early detection. When it comes to health, early detection is crucial. Many serious diseases, such as cancer, are much more treatable and have better prognosis when detected in their early stages. Persistent itching can be an early sign that something is wrong, and if you take it seriously and act in time, you can increase your chances of success in treatment. The power of early detection. Most of the time, cancers and other serious diseases don't have obvious symptoms in their early stages. However, certain early signs like itching can be key indicators that something is happening inside your body. The quicker you detect the problem, the faster you can receive treatment, improving your chances of recovery. Many types of cancer, such as skin cancer, lymphoma, pancreatic cancer, and inflammatory breast cancer, manifest subtly in the beginning, but they can be extremely aggressive if not detected early. The difference between early and late detection could be a matter of life or death, which is why self-observation and early medical consultation are so important. Acting quickly saves lives. One of the biggest tragedies of cancers and serious diseases is that they can often be successfully treated if detected early. When people wait too long to seek help, the treatment can become less effective. Diseases like lymphoma, pancreatic cancer, or inflammatory breast cancer, for example, have a much more favorable prognosis when detected in their early stages. It's essential not to wait for symptoms to worsen. If you feel like something is wrong with your body, such as persistent itching in specific areas, don't hesitate to see a doctor. Early diagnosis means you'll have more treatment options and a higher chance of success. The impact of prevention. Over the years, we've learned that prevention is one of the best ways to take care of our health. Getting regular checkups, maintaining healthy habits, and not ignoring the signals our body gives us can make a big difference. Additionally, early detection doesn't just help treat serious diseases, but it can also prevent them from developing into more significant complications. Remember, your health is your greatest asset. Acting quickly can not only save your life, but also allow you to enjoy a better quality of life over time. Don't wait for the problem to become something serious, especially if you notice unusual symptoms like persistent itching with no clear cause. 7. How to maintain preventive health to avoid serious illnesses. Prevention is one of the fundamental pillars to maintaining good health. While some diseases are unavoidable, many serious issues can be prevented or detected early if we adopt healthy habits. Here are some practical tips you can incorporate into your daily life to reduce the risk of developing serious illnesses, including cancer. Maintain a balanced diet. What you eat directly impacts your overall health. A diet rich in fruits, vegetables, whole grains, and lean proteins can strengthen your immune system and help prevent illnesses. Some studies suggest that a diet high in antioxidants, such as those found in brightly colored fruits and vegetables, may help protect against cell damage and reduce the risk of cancer. It's also important to avoid excessive consumption of processed foods, saturated fats, and sugars. These foods can increase the risk of heart disease, type 2 diabetes, and certain types of cancer. Opt for fresh meals, cook at home, and limit the amount of food with additives and preservatives. 2. Exercise regularly. Regular exercise is essential to keep your body strong and prevent a wide variety of diseases. Physical activity improves circulation, strengthens the cardiovascular system, and reduces the risk of obesity, which is a major factor contributing to various types of cancer. Additionally, exercise helps maintain a healthy weight, reduces stress, and improves overall well-being. Experts recommend at least 50 minutes of moderate activity per week, such as walking, swimming, or biking. If you prefer more intense activities like running or playing sports, aim for about 75 minutes per week. Incorporating physical activity into your daily routine can be as simple as walking more, taking the stairs, or practicing yoga at home. 3. Get regular medical checkups. Prevention is not only about leading a healthy lifestyle, but also about paying attention to the signs your body is showing. Regular checkups like mammograms, blood tests, cholesterol checks, and skin exams are essential for detecting diseases in their early stages. Even if you don't have obvious symptoms, these exams can identify problems before they become serious. Talk to your doctor about preventive tests you should get based on your age, medical history, and family background. Some people, especially those with a family history of cancer or chronic illnesses, may need more tests than others. 4. Avoid tobacco use and excessive alcohol consumption. Tobacco and alcohol consumption are linked to a variety of serious diseases, including lung cancer, mouth cancer, liver cancer, and esophageal cancer, among others. Tobacco is the leading cause of cancer worldwide, and alcohol, when consumed excessively, also increases the risk of developing several types of cancer. Quitting smoking is one of the best decisions you can make for your health. Additionally, reducing or eliminating alcohol consumption not only decreases cancer risk, but also has a positive impact on heart health, liver function, and mental well-being. 5. Manage stress. Chronic stress can have long-term negative effects on your health. While stress cannot be entirely eliminated from daily life, there are effective ways to manage it. Stress can contribute to high blood pressure, heart problems, and a weakened immune system. Additionally, it can increase the risk of unhealthy behaviors, like overeating or smoking. Practicing relaxation techniques like meditation, yoga, deep breathing, and mindfulness can help reduce stress and improve your overall well-being. Also, taking time for yourself, enjoying your hobbies, or spending time with loved ones is crucial for maintaining emotional balance. 6. Protect your skin from the sun. Excessive sun exposure can increase the risk of developing skin cancer, the most common type of cancer in the world. To protect your skin, use sunscreen with a high SPF, even on cloudy days, and avoid sun exposure between 10 a.m. and 4 p.m. when ultraviolet rays are most intense. It's also advisable to wear protective clothing and sunglasses to shield your eyes from sun damage. Persistent itching, although often ignored, can be a sign that something more serious is happening in your body. Throughout this video, we've covered how to identify warning symptoms, how to differentiate between normal and dangerous itching, and the importance of early detection to prevent serious diseases. Your health is your most valuable asset, and knowing how to listen to your body can make all the difference. Remember, early detection can be the key to successful treatment. Don't underestimate the symptoms and don't wait for the discomfort to become more severe. Prevention starts with observation and action. If you experience persistent itching, especially in specific areas of the body, don't hesitate to seek medical attention. The sooner you act, the more treatment options you'll have. Additionally, preventive health is the best way to reduce the risk of serious diseases. Leading a healthy lifestyle, exercising, eating well, and getting regular checkups are simple steps that can have a significant impact on your long-term well-being. If you found this video helpful, please remember to like and subscribe to the channel for more health and wellness content. Also, if you think this information could help someone else, share it with your friends and family. The more people are informed, the more lives we can save. Your health is the most important thing. Don't wait. Take action today to live a healthier and fuller life. Thank you for joining us, and we'll see you in the next video.